and here we continue with the La Mano con Lucy. And tonight we also have another one of our guests is Dr. Balmuri. Dr. Balmuri, he is a dentist in general practice for family practice. Dr. Balmuri, hi, good evening. How are you?
Good evening, how are you?
Welcome home. Can you tell us a little bit about general dentistry for children? We're gonna try here to cover different topics with you, and we're so happy to have you. So can you tell us a little bit about dentistry?
Especially, let me tell you first about my personal thing. I've been practicing about 25-30 years with plenty of experience with the different countries. This is my in America, the fourth country.
Wow.
To practice. As a general, I think I have good experience. I see a lot of patients ranging from children to old patients.
And currently you have a practice in which you dedicate to general practice.
Yes, I have practiced in East Orange. I've been seeing quite few, different range of ages.
So what can you tell us? What should we look for?
For about what, children?
Yes, for children.
Yeah, children, the thing that as soon as they get teeth, the parents should bring to the dentist for checkup, and the parents should teach them how to clean the teeth, and they have to show them as soon as possible.
Around what age? From birth to the first year, when do you recommend that a child should be seen by a dentist?
As soon as the tooth started,
As soon as the tooth started to...
The age may be about 6 months onwards.
Now, as far as the care, from birth to that first year, is it appropriate to start teaching your child how to brush? Is there any particular toothbrush that is used? Or in other, I have seen many times that parents use, I know because I did this with my own children, I used to clean my children's with a soft cloth from birth up until they were about 7 months old.
You can use a country like India. What we do, we don't get all these sort of things. And we take the toothpaste with the fingertip, like that, and we rub. Because we are, like third world countries, they are not rich, they can't offer. And that's the first thing. And second thing, you got to see the water, in everywhere in the world, the content of the fluoride. If it is certain percentage less, and you have to provide the tablet form or liquid form or drop form to the children, so that they get the proper, baby food.
Here in America, the water is fluoride.
Yes,
the water has fluoride. Now, should you suggest that how do we obtain this information? Do we go directly into the county where we live in to get that information, to know how much content of fluoride the water has?
Yeah, I think in America, all counties, they're providing fluoride water, and that fluoride is enough for whatever needed for the baby, And certain cases, it is suppose they are coming from different countries. In that cases, we have to provide the fluoride in the form of drops or tablets.
Oh, I see. Yeah. And when the children go for cleanings, for general checkups, you guys usually put the fluoride, which is a soft gel kind of. Sometimes it's a gel, or sometimes it's like a cream kind of thing that goes on.
And sometimes we have a suspension, that suspension with a small brush, and we apply that to the baby tooth, because they scare sometimes after the open the bottle, everything, So we have another kind of thing, so that children can't feel.
Now, what is the importance of the fluoride? What exactly is the function of the fluoride?
See, what happens is normally react with the teeth outside, that is called enamel.
Mhm.
and it reacts with that outer layer of the tooth and becomes hard, so that caries will not be formed.
So it prevents from forming caries.
Caries, especially number one. And after the children get about 6 years, and we use in the molar specially called the preventive for the caries, that is called sealant. You know that, huh? Sealant. Then the children should come to see a dentist as soon as possible. Tooth started erupting, and they must bring every 6 months or whenever there is a problem.
Okay. Now, children usually start teething around
We can say 6 months.
7 months.
4 months onwards actually.
Mm-hmm.
So with the front teeth, it starts about 4 or 5 months and end about 3.5 years for the baby tooth.
And it's very important in that period of time to start getting the child to get familiar with the dentist, so they can then don't fear of a dentist. It is very important. The reason why we're trying to do this is so parents that are seeing this show is that they understand how important it is for the children to start getting familiar at an early age with the dentist. Am I correct?
Yeah, correct.
It is very important that you guys start getting those children familiar with the process, so the children, as they grow, they're not afraid of the dentist. Because I remember as I was growing up, I was one that I was often threatened with the dentist. Lucy, if you don't behave, you'll be going to the dentist. We were threatened about that.
Yeah, that's the thing, you should, teach the child while brushing about the dentist. The dentist is a doctor. I will brush your teeth, and those cases the teeth is going to pull out and you will be short and lots of such things, Then you say that to the child when you go to see a dentist, you will count your teeth, such as 1, 2, 3 like that. Then in the middle he shows you, and just brush cleaning. That is it. Very simple,
So they can become familiar.
Mm.
Well, Dr. Balmuri, thank you so much for being here tonight.
You're welcome.
And stay tuned with us, because next week we will be entering on the topic of pregnancy and how a female should deal with the pregnancy and how that relates to your dental care. So we hope to see you next week, Dr. Balmuri. Thank you so much for being here with us. Thank you. And friends, will stay tuned with us, and we'll see you next time.
Okay, no problem.